Have you heard about the new blood test that helps to detect colon cancer? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side if you're watching us on YouTube. What a silly wife I have. Just love it. Our daughter gets so you guys got to stop doing that stuff on video.
So embarrassing.
So embarrassing. Anyways, if you're a first-time listener, welcome. And if you're one of our regular listeners and you've been on this journey with us, we love you. We thank you for taking the time every week to hang out with us for 15, 20 minutes. We know that your schedules are busy. All of our lives are hectic, and so we greatly appreciate the time that you take to be with us. Alrighty, so
a topic near and dear to your heart.
That's right, colon cancer screening.
I get pushed a ton of articles that come out, for all different types of topics, but primarily medical topics too, especially GI related. And the one that came out recently, I had to forward to you because I was like, she's gonna love this one.
I did love it. I did love it, yes. Apparently that came out last week, right?
Yes.
So apparently the FDA has just approved a new test. It's a blood test called SHIELD, and that helps to detect colon cancer. All right? So yes, you heard me right. It is a blood test. So you just have to give a blood sample, and that's it. You don't have to.
No more colonoscopy?
No more colonoscopy. You don't have to take a prep. You don't have to go through that tortuous prep.
Oh my goodness, Dr. Cruz, this has to be too good to be true. And it is.
And it is. And it is. And it is. I just don't know why they continue trying to.
Why are they trying to shortcut this?
What is wrong with the colonoscopy? There is absolutely nothing wrong with the colonoscopy. I mean,
it's the
gold standard.
Why
it's the gold
mess
standard.
With the gold standard?
I get it. People don't, I think probably the biggest complaint I have heard through my over 2 decades of practicing GI is that people don't want it prepped. The prep is horrible. That's probably the biggest thing, is drinking the prep the night before. I think another one is sometimes people are afraid of being sedated with, anesthesia and having an invasive procedure or having someone put something in their rectum, in their butt. I mean,
it's tough for some people.
It is tough. And I get it. There's a lot of different reasons, things that I've heard through the years from patients. But the bottom line is that colon cancer is one of the most preventable cancers out there. And yet it continues to be at the top as far as the leading cancer. All right, at least in the United States. There is no reason. And it makes me, even to this day, anytime I do find a cancer in someone, it makes me sad because it shouldn't be happening anymore. It shouldn't be happening. Usually it's someone that put it off and finally decided to go and get it done. And, it breaks my heart. It breaks my heart because it is one of the most preventable cancers out there. We have a way to prevent it. That test is called a colonoscopy. Yes, it is invasive. Yes, we're putting a scope in through your rectum and through your colon. Yes, you have to prep the day before. Yes, you're going to get some anesthesia and be sedated. But don't look at those things, okay? I mean, look at the bright side of it. Look at the other side of it, okay? And that's that we can prevent you from developing colon cancer by performing this exam on you, that where we go in, we're looking for polyps. If we find polyps, we take them off while we're there. And if that's a precancerous polyp, we just eliminated something that over time would have grown and turned into a tumor, into a cancer.
So talk a little bit about the blood test, and then, because
Yes.
there have been blood tests that have come out in the past similar to this, and every time something like this comes out, we always think, oh, people aren't going to do a colonoscopy now; they're just going to want this blood test. But
Right.
I think they haven't really been super successful for many reasons. I mean, one, the cost, right?
Right.
Even though it's just a blood test, these tests tend to be pretty expensive, and the insurance companies tend to not cover them for whatever reason. So
Yeah.
the patient is still putting out a lot of money, because that's the other thing too. A colonoscopy now with insurance the way it is, it can cost a decent amount of money
Sure,
for patients,
sure.
right? I mean, insurance is more expensive, but it's not covering as much as they used to. Deductibles are higher, so patients might have to put out between $500 and $1,000
True.
to have a colonoscopy.
True.
But the blood test costs just as much.
Yeah.
And then if it does find something, you still have to have a colonoscopy.
Exactly.
Okay? That's the next step anyway.
Exactly.
And then the blood test tends to not be very accurate. And so you get this blood test, it comes back saying maybe you don't have anything. But is that really true?
Exactly. And why is that? Because that test is probably only about 13% effective so basically the test is measuring DNA that gets released from these colon tumors into the bloodstream. Okay, notice I said colon tumor. Okay?
So you already have cancer.
You already have cancer. This test is about 83% effective with later stage cancer. All right, later stage cancer. Do you hear what I'm saying?
That means you already
That
have
means you
cancer.
already have cancer. That means that's when it's most effective. That's when it's the best test. It's when you already have cancer.
And now you're going under the knife.
Right, exactly.
sure. Yeah.
I mean, well, for sure
Not
you're going to
just
have a
procedure,
colonoscopy.
yeah, but you're
and
probably going under the knife.
Right, and probably going to get chemo, maybe radiation. It just depends, or maybe it's already too late.
Right.
Okay? Maybe it's already too late. So the test is a blood test. It tests for DNA that gets released from tumor into the bloodstream. And so basically, like we just already mentioned, it's
not detecting if you have polyps
Right.
that are precancerous.
unless it's like a very advanced polyp. I mean, I have found cancer in polyps in my career, but it's rare. It's rare. I mean, I could probably count on one hand, maybe two hands, the number of cases that I have found where the polyp actually had cancer. So if it is an advanced polyp, it might release some DNA into the bloodstream that would be picked up. But the statistics are that it's about 83% effective if it's a later stage tumor, okay, advanced colon cancer.
Okay.
About 13% effective on a more advanced type polyp. That's not when we want to be finding these things, okay? When we're doing a colonoscopy, the expectation is that we're going to go in there and maybe we'll find some polyps and we take them off and you're good to go. Not that we're going to find a tumor, especially if we're doing a screening colonoscopy, okay, which is just a baseline preventive screening exam to go in and look. Have I ever found tumors in somebody who came to me for just a screening colonoscopy who had no symptoms? Yes. And again, I can count those on my hand, okay, because it's very rare that person is coming in for a colonoscopy, has a screening, no symptoms, and lo and behold has a tumor. But I have found that. I have found that. But the majority of patients that are coming in for a screening colonoscopy are not going to have symptoms. Polyps polyps in general don't cause symptoms. I mean, unless you have a polyp that's really big, that is irritated, maybe it's leaking a little bit of blood just from being irritated. Okay, yes, but I'm talking about symptoms like abdominal pain and, diarrhea and constipation. For the most part, the majority, 99% of polyps are not going to cause symptoms, all right?
But they still need to be removed.
They need to be removed because if those are precancerous polyps, those are the ones that are going to turn into a cancer.
Right. So the whole point of the colonoscopy is to go in and get those things out
Yes.
before they become a problem.
Exactly.
A blood test is not going to do that for you.
No.
And if you do the blood test and spend all the money to do the blood test and something does come back, then you're getting a colonoscopy anyway.
Yep.
So you might as well just skip the step and just go have the colonoscopy.
Yeah.
Get the polyps out. Depending on how many polyps are found will determine what kind of polyps they are will determine how frequently you need to come back for colonoscopies. But that's the goal. The goal is to say, okay, I had 20 polyps, maybe 4 of them were precancers. We're going to be bringing that person back a lot sooner than somebody that only had 1 polyp and it wasn't precancerous. Okay?
Exactly.
But that's the point. If you're prone to make these polyps, then you need to be coming back more frequently to have exams and get this stuff out of the body so that you don't get cancer. That's
right.
the whole point of the colonoscopy.
That's exactly right. And you know, the cost of that test is about just a little shy of $900. The hope now is that because it is covered by FDA, that the FDA approved it, that it will hopefully be covered by Medicare and private insurances. But will it?
Yeah,
how much will they cover? I don't know.
There's already a test that's out, a blood test, and it's not covered.
Yeah, there was another
Medicare.
one that came out like in 2016 that is not well covered, and there's issues with the accuracy of that test.
Yeah.
So a couple things, you know, patients will tell me, oh, I don't want to do the prep. I tell them, you know what? I would rather torture you with a prep, okay, for one night, than to torture you with a diagnosis of colon cancer that now sets you on a totally different path where now you're going to be getting maybe chemo, maybe radiation, maybe surgery. You know, now you're on a totally different pathway, okay? So just do the prep. Just do the prep and get the gold standard, which the gold standard to this day is still colonoscopy. All right. Now, somebody did ask me when that article came out last week, somebody asked me about it. And, you know, I just become very passionate about this, maybe if you can tell. I mean, we could talk about other stool tests that are out there also. I think maybe we have talked about it. I feel the same way, you know, and so they were like, okay, it's very obvious that you're not a fan of these tests. Who would you consider doing it on? Who would you consider? Which is a great question. Because I've been asked that also even for stool studies, you know, like stool tests that test for blood and DNA. And so who would I guess somebody who is absolutely adamantly opposed to doing a colonoscopy and says, I will never do that. I'm not going to do that, but I want something. I want something. However, even on those people, I would still probably recommend a virtual CT, which is basically a radiologic colonoscopy. It's basically a very fancy CT scan of the colon that, in my opinion, is probably going to have better, it's probably going to show stuff much better than just doing a random sample of stool to look for blood or DNA and also a random sample of blood. Okay, because when you're getting blood, it's not like that DNA is circulating constantly, you know, through your blood. It's being released from the tumor probably periodically. So what if you go and have a blood sample drawn and at that time when your blood is flowing through, there's no abnormal DNA in there? What if? You know, because your blood is constantly moving. Your blood doesn't stay stagnant in one spot. You put the needle in. I mean, your heart is pumping blood all day long. You're pumping out liters and liters of blood. So, and it's the same with those stool studies. You know, like the big one out there is Cologuard. You know, I always say, what if the stool sample that you happen to submit for that test happens to be a stool sample that doesn't have any abnormal DNA or blood in it, okay? Again, you're not going to have, it's not like the blood and the DNA is going to be perfectly spread throughout your stool so that, you know, any piece of stool you get is going to show up. So when somebody says to me, I had a negative, you know, stool study, you know, a year ago, but now my doctor or whoever wants me to have a colonoscopy, or now I've had some blood in my stool, you know, and they're like, how is that possible? I'm like, it's so possible. Okay, because it could have been a stool sample that maybe didn't have anything abnormal in it.
And maybe initially they just had polyps, and now over the course of the year, that polyp has turned into something bigger. And
maybe, right? If it was a big enough polyp, absolutely.
Because even those stool studies are not picking up polyps.
Right.
They're picking up cancer.
Right. They're picking up abnormal DNA, blood, and there's other older stool studies out there that do blood.
A polyp, and a year later, that polyp's turned into something nasty.
Yeah. So look, the bottom line is, in my opinion, colonoscopy still remains gold standard. Okay, this stool or this blood test that has just been approved is not now. It hasn't become the gold standard in any way, okay? And keep in mind, again, that this test is going to be most effective when you already have pretty late stage colon cancer, okay? You don't want to get to that point. You do not want to get to that point. You don't want to, all right? Our goal, which is why they call it a preventive test, is to prevent you from developing colon cancer. So you want to get a colonoscopy. The age at which it's recommended now is 45 years old. That's for men and women. And I actually get this question a lot. People will say, hey, are those recommendations the same for men? Yes, they are. 45 years old, without any family history. Now, if you have family history, like let's say your mom had colon cancer and she was 45, or your dad or a sibling, that changes it. But in general, without that significant family history like that, it's 45 years old for men and women. Get your colonoscopy. Let your gastroenterologist get in there, do the exam. If there's polyps, get them out of there. And that gastroenterologist just potentially saved your life, or saved you from developing colon cancer. And yes, you will require more colonoscopies through the years. This is a test that will need to be performed to keep you polyp free. All right, that's the goal of it, is to keep you colon cancer free. All right.
Amen, Dr. Cruz.
Amen. All right. Anything else that we missed?
No, I think that about covered it.
All right.
You tell them.
That's right. That's right. Well, if you have any questions, if you want to connect with us, you can find us on our website, drlizcruz.com. There's a magenta colored button on the homepage that you can click and schedule a free 30-minute wellness consult. It's free and it's done over the phone, so you could do it from anywhere in the world. If you have not rated us, please rate us and please give us a 5. It'll help other people just like you to find us. And lastly, if you haven't subscribed to our podcast, please subscribe so that you never miss an episode. Thank you so much for joining us. We will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.